Preview.
Hello out there. I'm Dr. Maya 100, and welcome to another segment of Her Health. Today, I have with me someone I kind of came up with who was still always a mentor, always doing great things for the community. And I'll let her start off by telling everyone about herself and the wonderful things she's doing. Welcome and thank you for joining me, Dr. Kameron Matthews.
Hi, Maya, Dr. Green, thank you so much for having me. I agree. I feel like we have come up together over the years, and it's great to have this conversation today. I am a family physician, first and foremost, like yourself. We are proudful primary care docs, and will always definitely want to discuss primary care, especially in this type of forum with this audience. But I currently serve as Chief Health Officer with a company called Cityblock Health. We are a value-based primary care provider that integrates behavioral health and social care services into really a broader model of care that we hope is transformative in all that we do. And we focus mainly on communities with Medicaid coverage or low-income Medicare. So unlike a lot of the other value-based providers, startups, technology companies out there, we actually have a focus purposefully on those marginalized communities.
Thank you so much. You mentioned value-based, being value-based. For those out there listening, can you tell us a little bit about what that means?
This is an important question. I'm glad you picked that up. So the traditional healthcare system is typically structured with a model called fee-for-service, meaning just like you would go into a mall, a store, online, you purchase a product, a service for a fee for service. If you think about it, however, our healthcare shouldn't be incentivized based on kind of these billets of needs, right? And it shouldn't be incentivized to create more need, right? To keep the doors open, for instance, for a hospital, if you're operating fee for service, that means you want people in your beds, right? You want people to be admitted to the hospital, which means they're sick, which means they have, concerns that don't keep them at home. That's not the right incentive model for healthcare. We want to keep people away from the doctor. We want to keep people out of the hospital. But yet our fee-for-service model does not incentivize that. So the value-based system is more so what we call a capitated system. And unfortunately, that still gets associated with kind of what happened in the 80s and 90s with those HMO programs. There's a distinct difference now. But it's basically, I get paid to take care of a whole person. And I actually am paid to, therefore, keep them well, keep them out of the hospital, provide those preventive services in a holistic manner. I can take care of more than just what I can bill an insurance company for. And so therefore, the social care services that we provide in Cityblock, transportation, housing, food insecurity. I want to get into digital and broadband access and broader health literacy and even benefits optimization. Those are things that typical healthcare insurance plans don't cover, but yet we consider part of healthcare because it affects your well-being, it affects your outcomes. So the value-based system is that we see value in taking care of the whole patient, the whole person. You're not even a patient 99% of your life. We take care of the whole person, and we get even paid differently based on the outcomes. So are you healthy as opposed to, did I just check off this test on a list?
Wow, come on, Dr. Matthews. I love it. I love it. I really love about that. I happen to know, like Cityblock does that, right? And you recently joined at the start, I believe, of 2022. So congratulations on that. But you have a legacy of serving vulnerable and underserved communities. So it's like your passion, you met this organization and your passions just collided. Can you tell us, I know at one point you were at Cook County Corrections, and then you were at Veterans Affairs, and I know you don't like to talk, and then you have Tour for Diversity. I know you don't like to talk about all of what you do when you're given a space, but I just want to give a chance to let people know out there how your purpose started and
Yeah.
just run us through all of those things because they all align with their purpose.
I love it. Well, thank you. Yeah, it's thankfully it's not that long of a story because I'm not that old, but I have had a lot of experiences, so I'm happy to say that. So my first job out of residency, which is your training after medical school, after I became a board certified family physician, was at Cook County Jail, like you mentioned, over there at 26 in California. I was the lead doc for Division 11, taking care of minimum and medium security, mainly gentlemen, but I did occasionally help in the women's divisions. I also took shifts in the emergency room. That to me was the most meaningful experience that I've had in healthcare, to be honest, to be able to take care of a population of people that are purposefully and legally discriminated against. To take care of a group of people that we are allowed to completely marginalize, and society actually promotes that, to me is the most fulfilling. So the ability to provide them primary care, to connect them with even primary care practices after they left our services, to me is just the epitome of what it is to help a person. I got to learn a lot more about mental health and substance use disorder in there. Unfortunately, a good deal of my patients did suffer from both. The sheriff there, Tom Dart, remember he used to say in Chicago that Cook County Jail was the #1 mental health provider in Chicagoland. I mean, that says a lot when you're talking about the dearth of resources, particularly in Black and Brown communities. And so I became very comfortable in that space, and helping my patients really work their way through a lot of issues. However temporary of time they were with me. Unfortunately, even though it's jail, which means pre-conviction, I actually had a couple of guys that were with me 2 years. I mean, they were in there pre-conviction. We don't even have to talk about that whole issue. But got to really get exposed to a great deal more criminal justice issues. So then moved to my first of 2 community health centers. So these are some of the real safety net providers of the country. There's about 1,400 around the country. I worked at 2 in Chicago. You worked at another one, right? These are opportunities for docs to serve the underinsured or uninsured in a very holistic environment as well too, which is why I absolutely love that I'm in City Block now. It's the same sort of approach as community health centers often find. Took a couple of leadership positions and eventually became chief medical officer of that second health center. Started up our population health program, our cancer prevention screening program, had a lot of fun there. Then I transferred to the Department of Veterans Affairs. I had to move back east. I trained in Chicago, but from Philly originally, go Birds, and really wanted to be closer to my parents. And so chose DC, was looking to Philly, New York, somewhere on the Eastern Seaboard. But the VA called, and it was a decision that I really had to weigh. And I was just like, this feels so right, but I can't connect those dots between what my prior experiences were to move into the VA, but it just felt so right. And then finally, after talking with a mentor, he helped me realize I am #1 focused on vulnerable populations. I want to help communities. I just don't want to be that doc in the ivory tower. I want to be with people that need us. And I'm concerned about access to care issues. I want to make sure people get the services that they need when they need them and where they need them. And particularly for veterans, as much as the VA is able to help, we're not everything to every veteran. And so part of my job going to the VA was to expand access to care for veterans. I actually helped run the managed care program and eventually became, my title was Assistant Undersecretary for Health for Community Care. Community care was their payer program. So I got into healthcare finance. Don't ask me how. Ran that, helped implement a large federal program, $16 billion budget on an annual basis, and then became chief medical officer of the entire VA health system. During COVID, that was a lot to handle. Also helped with our electronic health record modernization effort. So all in an effort to really assist veterans with access to services. And then you're right. January, I transitioned to City Block Health. And for me, it was more so I had been in the VA working on multiple transformative programs in a system that was incentivized the right way. The VA is not as concerned. There is some financial concern, but it's not as concerned about insurance companies and billing. And it's really about fulfilling the mission and making sure that veterans get the care that they need. I didn't want to return back to traditional healthcare. And I was nervous. Where else would I go? Was I going to stay? Nothing wrong with staying at the VA for the rest of my career. But I said, if I'm going to transition away, it's going to be not to traditional healthcare, not to a basic academic medical center, not to a typical insurance plan where they're just doing things as they've always done. But I wanted to be a part of transformation. That's what I had learned in the VA, and that's what City Block is doing now. So they asked me to come on board as their lead clinician, chief health officer, and I am here to help us stabilize, to help us scale as we go into more markets. We're in 5 now, and plans for multiple more very soon. And yeah, so my career has, upward trajectory of leadership, but never wavering from really being a servant to the communities that need me most.
Amazing. That's amazing. As I look, you've either found your purpose or your purpose found you. I don't know which one is happening everywhere, in every stage, in every chapter. When did you first discover what your purpose was, and who were the influences for that? And what was that process?
So I always knew I wanted to be a physician, and I always knew I wanted to be a primary care physician. That was even before college. I knew that. And the reason why I knew that, my main influence still to this day, is my father. Lucky enough to have been the first in his family to go to college, went for electrical engineering, was working for Philadelphia Electric Company, climbing the poles and fixing, the electrical wires in the community. Realized he wanted to do more to help people, so took night classes and went to medical school. So my father actually really stepped away from what had been laid out in front of him and just became a pillar in his own community. So I remember quite vividly walking through our Philly suburb neighborhood, and we're walking down the street, going to some shop or something, and I hear Dr. Matthews screamed across the street. And he waves, he knows these people, and he's telling me, he's like, oh yeah, this child, and I helped the mother, and I just said, that is exactly who I want to be. That's the type of doctor I want to be. I want to know somebody well enough that they feel comfortable, like I'm a family member, and they just screaming for me across the street. And it finally then happened, some years later. Clearly we're in a room and somebody yells out Dr. Matthews, and we both go, yes. And I was like, so yeah, it was always primary care. Very different though, medicine from my dad. So like I said, Philly suburb, he's in a private practice in that kind of private hospital that I never wanted to be in. And he always recognized that. He said, our career is not going to be the same. People always said, why don't you go join your daddy's practice? I said, no, that's not the practice for me. I am really on a different trajectory. And he's always appreciated that and promoted that, and actually has even voiced his own interest in whether he should have turned that direction, as he sees kind of how passionate I am and how he's equally as interested in health equity and justice.
Wow. And then, so when we look at purpose, you mentioned earlier in the conversation, when you were at Cook County Corrections or Cook County Jail, you mentioned that the group of people you were honored to serve had been purposefully, and you said discriminated against, which reminded me, I think you're MD and you also are a JD, right?
Yes.
Yeah. So when you look at the holistic approach that you have in serving community, tell me more about why the JD also.
Oh, sure. So for me, it was, I want to help people. I want to help people who are marginalized or vulnerable in some way. And I want to do so at a larger scale than just one patient at a time. I recognized that very early on. And so I wanted to be a broader advocate in the healthcare space, but I wanted to be able to affect policy. I wanted to be able to make those decisions, my everybody's favorite quote from Hamilton, right? I wanted to be in the room where it happened, right? I wanted to be the decision maker, as opposed to like a lot of other docs we see, decisions are handed to them and they just have to practice within that space. I wanted to be one of the decision makers. And so for me, after working one summer actually on Capitol Hill, I worked on the Senate side for a Republican senator, which was an interesting experience, but I got a lot of exposure there to healthcare and to government. It really swayed me, along with another mentor who really made me realize that understanding the broader legal structure in which we practice and in which healthcare is offered was going to be helpful to me, and it entirely has been. I haven't practiced law. I took the bar, I passed the bar, and I wouldn't call myself a lawyer, but I have a legal background enough that I've been able, again, I think pretty young in my career, start on a leadership trajectory, be really involved with policy and advocacy work, even helping write legislation, helping implement legislation and regulation. I mean, there's no way I would have been comfortable doing the full swath of issues that I worked on at the VA, for instance, if I didn't have that background. So for me, law was just the perfect complement to the type of physician I wanted to be.
We don't know, because your purpose sends you in all kinds of, so you haven't
I think it's all
law.
connected. I think
Yes.
that's part of the problem, that in healthcare, we do this like siloing thing. We stay in our bubble. And for me, it's like, no, actually everything I've done is connected. Every single thing I've done is connected.
Yep. So I was like, you haven't practiced law. Yeah. Who knows what your purpose is gonna take you yet. So we don't know. We don't know, we don't know what she's gonna give, but she gives everything she needs to give us. So I think that's amazing. Another thing I want to turn to at City Block, you mentioned integrative mental health, physical health, social services. And we know, like, as physicians, people visit us for 20 minutes, maybe 40 minutes. They're living the rest of the day and their environment in the community, living the rest of the day with the social determinants of health.
Exactly.
Can you get into a little bit about why? And you also mentioned, when you were talking about Cook County Jail, the mental health and the physical health, how that blend causes, set the stage for a lot of the things that we see there around us everywhere. Where with City Block, tell us why that's so important for the patient's health, and not only City Block, but what you do in your purpose. Why is that so important for the patient's health to focus on social determinants of health?
Yeah. I mean, I think we all saw this quite to an emotional level during the pandemic of the past couple of years, how the impacts of social determinants of health truly are what direct us towards any level of outcomes. So if you don't have food to eat, if you don't have the appropriate food to eat, the right amount of food at the right timing, prepared by the right hands, how are you going to be able to take care of your diabetes? How are you going to be able to address obesity? How are you going to be able to address even your high blood pressure? Because unfortunately, a lot of our people that we serve don't necessarily even see the connection there, but nutrition is inherently attached to a lot of those larger chronic diseases that particularly affect our Black and Brown communities. If I can't give a patient of mine good instruction on how to get that moderate, vigorous activity to exercise in a neighborhood, because maybe they don't even have sidewalks, maybe there's safety concerns, maybe there's not lights on in their street, maybe there's not clean enough air, maybe the water is disgusting enough as it is in Flint that they can't even hydrate after they exercise. Again, how am I going to actually address obesity and diabetes and hypertension again when I can't even really help my patients seek out the physical activity they need just to stay well, let alone treat disease? When we're talking about lung disease, when we're talking about COVID, let's talk about, again, the dirty air, the lack of fresh air, the lack of open spaces. Let's talk about income levels and lack of insurance, so that perhaps they can't even go into an emergency room because they're nervous about the cost of the care that they're going to face. So getting away from direct impact of social determinants, income, education, insurance coverage, housing levels, housing stability, those all directly affect not only physical health as well as the stress that then impacts your mental health. So for me, it's impossible to divide physical, behavioral health and social services. I've always felt that way, again, as a primary care doc, that I'm treating the whole patient. And their care doesn't stop just at the definition of a disease. And in fact, we want to do as much as possible to prevent that. But if I can't help prevent the disease because of what's happening on in the broader world, in our communities, in our neighborhoods, then I personally, not every doc agrees, but I personally believe I should be advocating and finding resources to address those social determinants of health. If my ultimate goal is to keep that person healthy. And that was one of my frustrations. I saw that in early medical school. We're putting band-aids on things. We're writing prescriptions for disease as opposed to actually addressing the causes of the disease. And for the very same reason why I'm just as, and I know you are personally as well too, just as disgusted around racial justice issues and healthcare disparities. It's just as much as my passion to make sure that patients get equal and equitable access to care, and that we address the racism within our institutions that are actually causing them to have less or worse services and treatment and eventual outcomes. Those are all the social determinants of health that we see on a daily basis and that the people that we treat deal with on a daily basis. But yet healthcare alone, well, medicine alone, really doesn't have enough impact. That's why we need to think bigger.
That gets into, the more you explain, because we all, when you're talking to a group of physicians, we're all like, oh yeah, I'm family medicine, you're family medicine, things like that. And then when I'm hearing you, I'm hearing that JD, or is it a Juris Doctorate? Is that how you say it?
Juris Doctorate, yeah.
Come in, which is a law degree. And I'm hearing why that is pivotal. I mean, pivotal in kind of your work and your purpose and how you heal communities and your approach, because it gets into also criminal justice, right? What you saw, like, health justice, criminal justice, social justice. What are some of the cultural truths? Because you dropped some like very, important gems while you were talking about your work at Cook County and things like that. What are some of the cultural truths? So just give me the cultural truth that we have to face right now. And I know there's a lot, that comes to mind. If we could just deal with one, which one is at the top of your list to kind of say, hey, we got to face this. We got to deal with this. Without this, we're not going anywhere.
So I would say racism. I would, but I don't, as much as I think that is the number one. I would say when your question is asking, what can we do? I'm thinking, what can we do for ourselves? And I don't necessarily think we're going to be able to impact racism alone. We can't sit back as a community and change these ridiculous institutions that have been set up to keep us marginalized. So what can we do within our own communities to help ourselves? I actually think we need to address just the sincere myths and lack of access to services around mental health and particularly trauma. I think we as children growing up in our neighborhoods, as partners, as members of families, as members of neighborhoods and communities, at every one of those stages, I think we are faced with trauma. Actually, I mean, that's documented. We are facing trauma, and we do not deal with that well within our communities as far as discussing the impact of trauma, discussing the impact of mental health concerns that stress and trauma can bring on, let alone the kind of more biological and medical components of mental health, which we have plenty of in our communities as well too, and we don't want to discuss. But just the sheer impact of stress and trauma, particularly on women that we've seen over the pandemic, particularly on Black and Brown people in general, when we're talking police brutality and racism, we don't discuss. We don't have open forums and dialogues. We don't have enough mental health teams in our communities that know our experiences, because that's the other thing. I personally need to go to a mental health specialist that knows my experiences to help me get through it. I don't think we have outward enough conversations to really address that. So how we build up that workforce so that we can help ourselves, to me, is our number one concern.
Whoa, and you're already doing the work, Dr. Matthews. When I think about what you're doing at City Block Health, not only that, so you'll be able to impact the way that medicine is approached there, but you even took it a step further, right? You're building a legacy of healthcare professionals that will carry on. So not only while you're kind of on this earth, in your practice and things like that. But through Tour for Diversity in Medicine, you're building a legacy that this is going to go on and grow for our community. You mentioned you need to go to someone who has your shared environmental experiences, because there's a lot of nuances that 15 minutes, that 20 minutes, that hour is not going to unpack all those other things. So people need to come to the table understanding kind of some cultural truths about the person before them. And Tour for Diversity exposes our community to healthcare careers so that our community can, in the future, through a legacy, be exposed to equitable health. Can you tell us a little bit about Tour for Diversity in Medicine? When did it start? And congratulations on your 10-year anniversary.
Thank you. Yeah, no, I'm still in shock and awe that it's been 10 years. We started this nonprofit organization really as kind of a grassroots sort of effort of programming where we take physicians, dentists, and now pharmacists around the country to lead what we really consider to be exposure programming. We're not a longitudinal mentoring opportunity at all. We like to direct our students to that. But it's really meant to be exposure, that we are reaching students that maybe have never seen a Black or brown physician before, have only seen that depiction of Dr. Cosby on TV, and we don't even need to talk about how that depiction has been tainted, right? I think, so many of the students we reach have also had, even if they understand that this is something that other Black and brown people do, they've also had absolutely poor mentoring and advising to help them seek out opportunities within healthcare. So the tour, sorry, I'm going around again. The tour is meant to do exactly that, expose them and motivate them just through a set of really structured pre-med enrichment programming. We visit campuses, mainly HBCUs and Hispanic serving institutions and community colleges around the country, and lead one-day programming to motivate them and to hopefully direct them towards opportunities to really join healthcare professions in the future. We've reached 27 states. We have, we're not the panacea. We're not talking about every healthcare field out there either. We're doing our part, small as it is, but I think we're making an impact. And now that we're mainly virtual, even more of an audience is finding us, and we're really happy. We're hoping to get to our first tribal college by the end of the year, and we'll just keep growing.
That's amazing. And thank you for that work. Quickly, if I'm out there and I'm interested in Tour for Diversity, or I want to connect my child with it or find out more information, quickly, where could I find more information about that? And I'll bring it back at the end of the segment.
Yeah, our website is tourfordiversity.org, and it's the number 4. And more importantly, actually more updated, and particularly for the student themselves, we're all across social media. We post all of our programming, usually evening and weekend events, across Facebook, Twitter, Instagram, LinkedIn as well too. And the idea, again, is to just introduce them to young practicing docs and dentists and pharmacists that look like them, that are maybe from their neighborhoods, that maybe have had those difficulties that they've had. Most of our target is high school and college students. We haven't gone younger in the pipeline yet. So our focus is a little bit more academic to help those students that need it. And let me pause for a second because my dog is going crazy. Come on, go up. Driving me crazy. There we go.
So thank you so much for building those bridges, Dr. Matthews, with Tour for Diversity. I just want to back up to something you mentioned about the pandemic, and about something you're seeing, a cultural truth that you're seeing over the past couple of years. You mentioned that women, are suffering, all kinds of trauma and, being underserved during this pandemic. But before, we really want to lift up our women, because we know our women a lot of the times are holding a lot in our communities and building bridges in our communities. Do you think it's important for women to go into medicine, women to be part of kind of the leadership structure of healthcare? And if so, why?
Hands down. Hands down, I do believe that we need more women in leadership across the board, not just in healthcare. I think the past couple of years during the pandemic, if you're reading any of the data that's being shown, it's women that needed to respond to the lack of childcare, the family caregiving that was necessary, as well as people were losing jobs, as food insecurity and housing insecurity started to increase, as essential employment became just so difficult for a lot of our communities. Unfortunately, a lot of that burden was shouldered on the backs of Black and Brown women. And I think we're starting to see, particularly in healthcare, both anecdotally and some data, that mental health concerns have started to worsen as well too, particularly for women. I think the very reason why women need to be, particularly in healthcare, in higher leadership roles, is because we need to have been able to respond to that crisis more quickly. Why, when we're talking about major healthcare institutions with extremely large populations of employees, of staff, why are there not childcare centers at every single one of our hospitals? I mean, why are there not more opportunities for family caregiving? I am personally dealing with an elder in my family that needs 24-hour caregiving support, and there aren't services out there, daycare or overnight, that are really meeting her needs. Why do we not have a employment structure that is more responsive to that? I believe if women were more in leadership, that we'd be seeking out those opportunities, because again, it's the women that are often the ones having to deal with those as far as within just our social structures and our family structures. So for me, women in leadership is a necessity across the board, not just response for the pandemic, but just, to be honest, when we're talking equity as well too, when we're talking those of us that look like us, that want to become leaders, we're more likely to as women. I hate to say that, but we can really help pave a way to truly diversify not only what leadership looks like, but how we also think. And there's a whole set of literature out there about women versus male leaders, and how we approach problem solving and leadership in general.
Thank you for saying that. And in this response, you mentioned Black and Brown women stepping up, leading the way, and offering a lot of community healing over the past 2-something years during the pandemic. You also mentioned, now on the heels of that, trauma, and the need for integrative mental health services in their daily lives. I'm seeing that too. I'm seeing a lot of the women that kind of were part of the response. On the other end, they're like, oh, I need a mental health provider, things like that. And in a lot of ways, it doesn't have to be a doctor. It can be, a woman in the community, making sure there's food given to our elders and stuff like that. Now, on the other hand, on the other side of that, you're one of the women. What kind of foundational things are you doing for your self-care to make sure you have longevity kind of in this process? Because it's, there's some weight, it's levels to this stuff, and there's some weight to what kind of you do.
There's a lot of weight. Thank you for asking that. I am not afraid at all, or have any desire to hide that I've been struggling at balancing, dealing with stress, dealing with even just kind of the societal sort of angst that, especially the past couple of years with the racial justice conversations, how that's weighed on me. For me, I turn towards my husband. I turn towards my family, my friendship group. I get a lot out of peer support, to be honest. I think of them as kind of my counselors, in that sort of sense, that you don't need someone with a degree or something, just someone to talk through issues, to share similar circumstances with. I turn towards a lot of friends. So I make time purposefully to have those conversations. And that's my form of healing. along with crying every once in a while. I cry in times of stress. I will come home at the end of the day and just need to cry, just let it out.
Mhm.
Sometimes followed with a glass of wine, yes, but at a healthy level. What else do I do? I started running now almost 10 years ago. So physical exercise is a big deal for me. I love getting on. Well, it used to be outside. Now I'm on my treadmill, just for safety issues and because I need to run earlier and earlier in the morning, and I'm not doing these DC hills at 5 a.m. I like the feeling of sweating it out and my brain gets clear. I don't even put music on. I just go, I think through my to-do list or something at work. Inevitably, I will jump off the treadmill and write something down, like I came up with an idea, and that helps. It clears my mind significantly. And then just complete detachment, I'll say, is the last one. I think we often feel the weight of the world on our shoulders, and we feel we're not doing enough, so we just keep going until we fall apart, where I absolutely refuse to fall apart. So there are evenings, there are weekends, there are vacations where I completely leave my cell phone. I put on some absolutely ridiculous Netflix series or something, and I just completely detach. You can't find me. You don't need to find me. If there's an emergency, call someone else, and that's my form of saying no to the outside world, right? I have gotten better at that. And just even in 2021, like my husband and I, we just took these fabulous little breaks, 4 days here, 5 days here, left the cell phone. One of them, they did call me and I had to take a meeting, and it stressed me out and I could feel it. It was all coming back in and I was like, let me go.
Mhm.
And so I try to preserve that time, and my husband does the same. He'll see me looking at my phone. He's like, put it down. The detachment is necessary. We need to mentally step away.
Hmm. And you mentioned the ability to say no, which we know a lot of women struggle with, because a lot of times in our society, we're, raised to be a yes person too, and to be people pleasers. And that plays out a lot of times in the exam room. Women, we go to see our doctors, we show up. We don't show up. We send our representatives to see the doctor, right?
Exactly.
Instead of, kind of leading the healthcare exchange. If there are three things as a woman, and if I'm a woman, I'm looking at my preventive health, which is going to help me with my longevity. Yep. What three things would you advise every woman? Day one, preventive health. What are you going in there asking your doctor about?
That's such a great question. So for me, hands down, I'm going to be thinking about prevention first. I want my ladies thinking about prevention first. So based on your age, we have very formal recommendations of what we should be doing as far as testing, your mammography, your colon cancer screening, cervical cancer screening. Of course, that's a different kind of time frames throughout your life and everything, but other preventive screenings as well too. I would like every woman to come in and talk to their primary care doc, of which many women don't have that. They may have an OB or a women's health doc. They may go to another specialist or whatever, but the preventive services are being done in primary care. So I would ask, what preventive screenings should I be thinking about right now, a couple of years down the line, so I can get mentally ready to undergo those? Because a colonoscopy is not exactly an easy thing to step into a room and be ready for. What I would also be asking about is whether I'm at risk for anything. Whether I don't know any of my habits are causing, maybe some concern, maybe the way I'm eating, my lack of exercise or kind of sedentary activity. Am I a smoker? Am I a heavy drinker? Do I have any family history of anything? So you have to understand that what goes on in your family doesn't always mean that you are going to get the same experience, but it's increased risk. So you need to look at the holistic picture of where your risks are so that maybe you can adjust your behaviors or perhaps plan ahead a little more. And then I would want to have, lastly, I would want my patients to have that conversation about kind of stress and kind of the mental health status. I want my patients to come in, and hopefully I have earned their trust enough, because that's the biggest thing. I need to earn their trust. They don't need to just share information with me, but after I've earned that trust, share with me what your stressors are, and let's see if there's a way that we can figure out. I'm not going to be the only solution, but maybe I can help you figure out how to address those. For me, those are hands down. Let's talk about preventive screenings. Let's talk about risk factors, and let's talk about mental health. That's hands down what I truly believe women need to be focused on. Because no one else is going to be doing it for you. Not a single one of those. Not a single one.
Yep. That's couldn't have said it better myself. That is wonderful information for our listeners out there, our women, and anybody else who may have tuned in. Dr. Matthews, is there anything else that I should have asked you about? Any other message for anyone listening or watching that you want to get out there?
Not that I can think of. I think you've hit a lot of things. I've had unbelievable experience, and I feel like I'm still so early in my career that I just hope that maybe there's some other young ladies out there that just feel that feel just as kind of motivated to keep moving ahead towards a mission. That's how I think of it. And you kind of described it earlier, kind of what was my motivation and everything. I think of this as my personal mission of what I'm doing. So therefore, even though I'm tired, even though sometimes, yes, I'll say no, I think over my career, over my lifetime, I hope to achieve my mission. So hopefully that's motivating. It's going to be different for every young lady out there. That's what I often try to point out. Don't ever try to copy anybody else, because you're the only one that can do what you're going to do and what you have done, right? So
that's right.
I hope people use my story as just perhaps a display of kind of lack of that fear, lack of that imposter syndrome. Like, no, we're going to do this. You're going to have an interesting path to get there, but you can do it.
Thank you, Dr. Matthews, for you being the only one that does what you do. And thank you for the way you do it. Thanks for joining Her Health. And thank you to our viewers who've joined. I'm Dr. Maya, and thanking Dr. Kameron Matthews, a great sister, leader, mentor. And you're watching Her Health, and we're closing out.